You're live.
Hello, guys. Sorry for my
Welcome.
2-minute tardiness.
Technical difficulties.
Yeah, we figured it out. So thank you for joining my very first live webinar. This is going to be on neurotoxin. Oh, yeah. Ashley's my IT gal because I'm terrible with stuff. So today we're going to talk about neurotoxin. I have a little slide. Hopefully you guys can see it. It's sculpted with Megan neurotoxin right now. This will just kind of give you like a little bit of a visual to see what we're going to talk about today. So
let's see. Let's see if we've got some viewers. Ooh, that's not the right one.
That would actually be hilarious.
How many watchers do you have? I can't remember where she said you look to see where they're at.
Yeah, I don't know.
Anywho, continue on.
I'll continue, even if I'm talking to myself. It's fine. So they're on the YouTube link there. You should have a little chat on the side. So if you guys have any questions like during, I will definitely answer. Ashley's going to try to answer them for me since I will be talking. If not, we'll get to your questions and all that at the end. So today, neurotoxin. What is neurotoxin? It is a neuromodulator. So what that means is it's a botulinum toxin that goes into the muscle that basically enables that nerve to contract the muscle. So I have a little skit on here. I think the difference between neurotoxin and filler, actually, I don't know, so ago. It's not filler, but we'll get to that. So neurotoxin, for example, so it stops the muscle from contracting. So if you have little static lines on the forehead, your horizontal lines, I don't know how close if you can see it, that sometimes you get your static lines. So that is where those lines should stay. If you inject neurotoxin into that, aka Botox, Dysport, whichever, it's going to soften those lines greatly. Now, keep in mind, if you do have deeper wrinkles on the face, you're, say, 65 and never had Botox before and you have deep wrinkles, yes, it will help soften them. I can't guarantee you that they're going to go away completely. But the static lines, absolutely. Also, you hear people, say, 28 years old getting neurotoxin, and you're like, that's too young. You can't. Why are you getting Botox at 28? It's actually a preventative. So it's preventing them from creating those wrinkles in these areas. And again, I'm going to go towards, I actually have my little model here that I'm going to face here shortly so I can see the different areas and what they do and all that. So let's move here. Okay, what types of neurotoxin is there? We have, our most common is Botox. Everybody knows Botox. It was the very first brand name. I even still say when people come in, oh, you're getting Botox. It's not always that, but they know what you're talking about. So we also carry Dysport and Xeomin. So we will hopefully one day carry Daxxify, which will be amazing because it is actually going to be it lasts a lot longer for you. So basically, so how does tox work? I already explained that. We'll move on. Difference between Botox and Dysport. Honestly, in the end game, they do the same thing. Neuromodulators, they both stop that muscle from contracting temporarily, never permanent. So think of it as, so Dysport has a little bit more spreadability. So you kind of want to put that in more of a larger area, like the forehead or your masseters, larger muscles that you have on your face. Dysport also kicks in quicker. You'll start noticing a difference within probably about 3 to 4 days versus Botox, where you might not get your full effect till 10 days to 14 days. So Botox is really good. I mean, you can absolutely do it in larger areas. It just kind of targets more in a smaller area. So Botox is great for like around the eyes, your lip lines that you have, or AKA smoker lines. You can use it in those muscles. So if that gives you any insight in between those differences. Um, and then which is the best neurotoxin for you? So that depends. Debatable. You can, I mean, honestly, which one you liked better, it's going to be a journey. It's going to be a trial and error. You know, we're going to try Botox on you, and you're going to be like, wow, like I was super froze, and maybe I want, you know, maybe we do a different injection technique, or maybe we try Dysport and see which one lasts longer on you, see which one works better, which one you like better, because we won't know until we actually do it. So, if that kind of gives you that's what I try to explain to everybody. Yeah, some people Dysport does last longer, and I'm not that gal. Botox is my jam. I usually get a good 5 to 6 months out of it. Dysport not so much. So you don't know till you try. So if that answers that. Common concerns I have with tox. I don't want to look unnatural. I hear that all the time. Neurotoxin, you look completely natural, and that's our goal here at True Body. Is we want facial balancing. We want you to walk out of here looking and feeling your best. So yes, we are absolutely, you're going to look 100% natural. You're still going to have a little movement. Nobody's going to know.
It can be done. So.
Yes, it absolutely can be done. I actually have a picture in here to show of a gal that she wants to be totally froze. More power to her. But if that's not what you want something like a little bit of eyebrow lift or just a little bit of movement, we can make that happen. So don't ever feel like you're going to look natural. And yet, of course, we'll talk about it at any consultation that we do. And then, sorry, Ashley's playing with buttons. Squirrel. Yeah, no, just we'll talk about what you want and the look that you're going for, and that's what we will do. So fantastic. Another one, eyelid droop. Those are extremely rare. So you go down the rabbit hole online, you're looking at bad Botox jobs, whatever. Eyelid droops are extremely rare. And yes, you know, it could be something like, you know, the person went home and they didn't follow their aftercare instructions. They went home and they scrubbed their face, or they went and took a nap or whatever. And yes, the neurotoxin can migrate. It absolutely can. And you gotta follow the rules. Sorry, guys. So just, I don't want anybody to worry about that. We've never done it to anybody. Very, very rare.
You'd almost have to be pretty intentional.
Yes.
If you were going to cause
an eyelid droop.
An eyelid.
And what that is. Yeah.
Don't say that.
Don't say that, Sarah. Oh, yeah. Yeah, some people, you know, but it's not going to happen. Nope. Hooded eyes. So this is a kind of a big one. If you have hooded eyes and you want neurotoxin on your forehead, odds are you're going to feel heavy. It's not a drop. It's not an eyebrow ptosis, nothing like that. You're just going to feel heavy. You're going to feel like, oh, I was putting on my mascara and I had to lift my eyebrow to, you know, put my mascara on. It's kind of one or the other. Yes, I can inject higher and you might still have lines and you may not feel the heaviness. So you either want your horizontal lines gone and you're probably going to feel heavy, or just don't even get it and just let them roll. We can treat other areas. But yeah, that's definitely a common thing that, you know, we've learned over the past.
You've never gotten tox and then you get tox in your forehead. It's going to feel unnatural no matter what.
Oh, it does.
No matter what. The first time, maybe even the second time, you're like, holy smokes.
You do. It feels very weird when you get neurotoxin for the first time.
Yes.
You get used to it.
We're
correct.
And that's why we take before and after pictures.
Exactly.
So we can verify.
Yes.
Do you look heavy or do you just feel heavy?
Yes, exactly. But any other eye set, it's very rare if they say they feel heavy. If you do, please don't be like, Botox isn't for me. I can't do this. It could just be a different injection technique that we need to do. And that's why I say that Botox is a journey because, we're learning with you. So yes, we know our areas to inject. We're going to do what we think is best for you. But journey. So other one, I told my husband, he won't. Nobody's gonna know. The only people that I feel like know that you have Botox, number one, if they have had Botox, two, they're in the aesthetic industry. Only people, even the people you live with, your mom, your sister, whoever, your friends, they're not gonna know. Thank you. They're not gonna know. So I mean, odds are they're
unless
not.
you see them right after your treatment, they might know.
Yes, and we'll definitely get into that as well. So, okay. Prior to tox injections, what you need to know. So the big one, say you took ibuprofen the night before, and you're like, oh my gosh, I can't get Botox. I took a ibuprofen or Aleve or whatever. It's not necessarily going to affect the efficacy of the Botox. It's just you're going to have a higher risk of bleeding and bruising, which is very common, or kind of common, and is kind of expected in neurotoxin treatment. But you're kind of putting yourself at a higher risk of doing that. So don't worry about that.
Needle in your face.
You have a needle on your face. Yeah, you get a needle in your face. I mean, and you have a lot of vasculars, especially around the eyes. That's probably my most. So we try to look for vascular. We try not to eat more hip. Sorry. It does. Just know I'm very sorry at the bottom of my heart. We do our best. So that's kind of the big one. Caffeine. Yeah, alcohol, anything that's blood thinning, getting your blood flowing, those, yes, will have an increase of bruising and bleeding. So keep that in mind. Other than that, pretty good. What to expect? Oh, look, my pictures popped up, and there's two of them. That's cool. They weren't on there earlier. So what to expect? Inject, obviously, you'll probably have they look like little mosquito bites, kind of. We dilute it in saline, so you're gonna have that dilution of saline in there, so you're gonna have fluid that's gonna be kind of hanging out right there. They look like little tiny mosquito bites, and they should go away within 20 minutes, 30 minutes, just depending how quick. That's totally normal. Painful, I get that a lot. Not really. I mean, there's areas that are a little bit more sensitive than others. It's not that bad. It's so fast. We have distractors. Like, I've never had anybody tell me no to do their Botox because everybody wants it. They just, it's not bad.
They get through.
You get through it. Beauty is pain. So true. So, sorry. What else during the treatment? Again, bruising. That's pretty instant. We usually know when we bruise. Sometimes they sneak up on you a couple days later.
Can somebody come in without makeup on?
That would be very helpful. You don't have to. You can wear makeup. Totally fine. If you are wearing a good slab of makeup on your face, it's really hard for me to see vasculars. But the infection on your Botox is actually so low. And we clean you, obviously, before we do any treatment. You can wear makeup if you want. You can, even when you leave and you're like, I'm not walking out the waiting room without makeup on, you can put some on. You just need to be very, very gentle about it. So I'm about to get into that. But preferably if you can come in without makeup for really any appointment, skin consultation, laser treatment, Botox, filler, that's
But you don't
ideal.
have
But you don't have to. You came in from work, totally fine. We'll take care of it.
to on it.
Fix you on up. So just myths and facts I threw on here. Myth, neurotoxin makes your face feel stiff. Not when done correctly in the way that you want to do it. Some people want stiff. Some people want absolutely no movement to their face, and good for them. I don't know. I mean, they don't want wrinkles. Happy for you. Yeah. Happy for you. So it is. It's all about precision and dose, and we're very, very highly trained where to inject and dosing. And sometimes your dosing is also a journey. You know, I might do 10 units on Sally Bob on her forehead and 4 on the other, you know, and it's just one feels too much, the other not, or they feel the same. But we are definitely trained in that, and so no, that's a fact, or that's a it lasts forever. No. I use my hands too much, guys. I can't help it. I'm sorry if I'm shaky. So no, it does not last forever. All neurotoxins are temporary. So typically you'll need maintenance, every 3 to 4 months. That depends. What does that depend on? If you work out, you're going to metabolize it quicker. If you just have a natural high metabolism, that's probably going to make it go way quicker. You might need it every 2 months, every 2.5. Average
depends on the dose.
Depends on the dose too. Typically, first timers. I don't know if you do this, Ashley, but you do. I go quite a bit lighter on first timers because I don't know how sensitive you are to neurotoxin. That might last you 5 months, and okay, that's your dose. You know, better to underdose than find out later and spend less money than overdose you and think that's what you need for the rest of your Botox. Yes. Yeah. So that just depends. But yeah, usually average is about every 3 to 4 months. We do encourage full movement of your muscle before you getting your next neurotoxin. The reason being, you don't use it, you lose it. It's actually a real thing. So you can atrophy your muscle. You don't use it. Mine's coming back, and I'm not happy about it. But I have to be strong and wait. So yeah. So maybe a good time period for somebody is every 6 months. Come in every 6 months.
Depends on your age.
Depends on your age, 100%. If you're a little bit older, different story. But that is that. These are just some examples. So this is my gal that wants to be frozen, completely froze. She's like, do not give me anything. I don't want any lift. I want nothing. And I said, okay, girl, you got it. So this is why she's kind of, she's lifting on that after picture. She got nothing. Good for you, girl. So that's just one example. This one, she wanted more of like an eyebrow lift, a little bit of movement kind of in that outer eyebrow. So we went a little bit lighter out there. That way she can kind of move. You're good. So there's different ways. It can look so stinking natural. When her pulling, I mean, you can see movement. Obviously, this is in a video of the picture, but you can see a little bit of movement in her eyebrows. So you want to have some expression, right? About 90% of people do. But we can make that happen. If you get the Spock brow, I tried to fixable. So what that is? Show you. Yes, Ashley will show you. Pocket.
Let me move so you can see the light. I have no toxin in my forehead currently. If I was going to have a spa, this is what it would look like. But that's fixable, guys. There's no problem.
Yeah.
We're not worried about it.
We're not worried
if you have
about
a Spock brow.
Yes. If you have a Spock brow, we can fix that. If you feel heavy, It may or may not go away in a couple more weeks. We could probably throw some saline in it to try to lessen it. But we can fix this box. So
Spock is
if you're like, yes, Spock is better than a drug. And sometimes it happens because you are first time. You don't know how you respond to it. And I'll do it on again, Sally Bob, and she's perfect. And the other gal is like, oh, nope, I got a Spock. I'm like, okay, well, let's do your 2-week follow-up and we will fix it. This one. So this is neurotoxin, which we're about ready to get into because I've obviously got to talk kind of quick because we're very close to being done. We did her masseters, which are when you clench. Some people clench at night when you're stressed, when you're concentrated. Typically for TMJ, it can cause headaches, migraines, whichever, pain, all the things. So, and the cool thing is, you kind of look at her lower face, it gives you a little bit of a facial slimming too. So some people get that just for the facial slimming, but it's mostly for TMJ. But I'm happy to do if you're like, I want to slim out my face. Let's do it. Yeah, let's do it. So, without further ado, this is actually going to be my filler one that I'm doing next. So we're saving that piece. Aftercare. Let's kind of go towards Sarah. So Sarah, I'm going to
Hi,
aftercare.
Sarah.
Hello, Sarah. This is our beautiful model, Sarah. We're going to do some injections. You might not be able to see all of it today, but for Sarah, we're going to tell her aftercare, what to do, what not to do. No laying down for 6 hours because you can migrate that solution.
Gravity works against you.
Gravity, yes, it does, unfortunately, in all ways.
In so many ways.
And then you can scratch the area if you have like a little itch because oh, I can't touch it, and it's automatically an itch, right? You can scratch it, just no vigorous rubbing for 6 hours. Even when you go home, you are getting ready for bed and you're washing your face, just be really gentle that night, just to prevent migration.
Give yourself the best face massage you've ever had. Okay?
No, don't do that. You can do it in areas that aren't treated, but not in the treated areas. Working out is kind of controversial. I just say 24 hours. You don't want to get your body temperature up. You don't want to get the blood flow moving. No saunas, no hot tubs, nothing that's going to raise your heart rate because that will also decrease efficacy and also increase migration. So, none of that. Thank you. So for my last 5 minutes. Okay, so this is a muscles of the face, and I might actually, if you guys want to watch it, we'll see. But I kind of want to touch on this.
We can talk and
well, I want her to animate.
Yeah.
So this is your frontalis. This is when you raise your eyebrow, creates all of those little horizontal lines that. So if you do that, and you don't get tox, those lines are going to stay. They're going to stay. They're going to get deeper. Then you're going to
just be like folding a paper 1,000 times.
Exactly. It's a great way to put that. 11s. So that is what creates. Everybody's 11s are a little bit different. Sarah's she got a nice little Sarah's there. So you have 3 muscles that work together to create those 11. So that is your corrugators and your procerus, glabellar area, glabella. Crow's feet, big cheeky smile. Those lines that are created right here. That's a really common area to get treated as well. Yep, feet. I'm just going to touch on a little bit of everything area because a lot of people don't know all the areas you can treat. Because you can absolutely treat the whole face. I've had a lot of questions on that. We're actually going to do that for Sarah, but a long time. But so
I think we can go over just a little bit.
Yeah. Okay. So lower face, you have your TAOs. So Sarah, you got good ones. Do you see how she pulls in that little? So when you're frowning, whatever, all those muscles are pulling down. So if we paralyze them, it's going to bring them up. And it's not going to see, you're not going to have a Joker smile. You're not going to look weird. It's just keeping everything from pulling down. So you also have this muscle right here.
I can't remember that.
I can't remember what it's called. So this muscle as well is kind of where the jowling starts. You can inject in that too, and that's going to give you that lift. And one more muscle that is going to help treat your lower face, that is literally going to give you a lower face lift, is what we call it, is your platysmal bands. Right here. So if you can see these platysmals, they're kind of adjacent to anywhere there would be jowling. So that is going to help lift. Yep, these guys are happy. And it's just going to create a pretty little lower face. Great look. Very subtle. Nobody's going to be like, oh my God, you get a facelift. It ain't like that.
It's not like
Not
that.
even close.
It's just like, but maybe.
We're doing those here now.
Yeah.
Sign me up.
Again, ambassadors for TMJ. An area.
Punch down.
Hippie to clench.
Relax.
See your
Yeah,
finger
squishy.
going out.
No, yep.
So yeah, that's really good facial slimming and TMJ. If you get headaches from it, sometimes Botox and the frontalis 11s, depending on where you carry your stress, can really get headaches too. So we have a little temporalis muscle. If you clench, you can feel it pop up.
Right about here.
Yep.
Yep, there you go.
That one too, we can inject as well to help with headaches if you get them with clenching. So I had a gal one time came in, did her masseter. She's like, I still have a little bit of headaches. We injected the temporalis and they were gone. They were gone. Eyebrow lift. Everybody loves a little bit lift, right? The tails. And you can also inject your nose if your nose flares. When you're laughing or talking. I'm still going.
Yeah. Here you go.
You can absolutely inject right here. You can do lip flip, not filler. It's gonna give you just a subtle little lift just to make it look like you smile. You have a upper lip. Say you smile, smile really, really big, and your gums showed, which hers do not. But if they did, we can do a gummy smile injection right in here. And so when you smile, like, oh, I hate my gum smile when I'm in pictures and whatever. Everybody has something. We can fix that. A little bit of Botox, easy peasy. Obviously, there's a ton of other places that we can inject. You have your baby Botox, your Barbie Botox. You can do little blobs under the eye to help with those little wrinkles that everybody has, including myself.
I think I'm too far gone.
Oh my gosh, yeah. So yeah, those are kind of, but the most common areas are kind of what we touched on today. I can absolutely do another video with questions. I can even just hop on Instagram to kind of answer your questions that you have, and then
Some hiccups.
we probably have maybe some chat questions too. And Ashley's, you or Ashley can touch on.
Why don't you mark her up and I'll look at
Yeah.
some questions.
So,
You guys have questions? Put them in the chat. Put them in the chat. Sorry, I'm trying not to squint at you, but
Oh, Lord.
the light's bright.
Okay. So this is gonna be the most. I mean, we're definitely gonna inject EAOs. Hold down.
Don't forget to mention your call back.
Oh yeah. I do. Okay. That was one thing that slipped my mind. So right in these quote unquote drawing areas, you have a muscle under there that's gonna help you. really want to do more of this area here. So you really don't have a strong autism. But right there. I think, and then we're gonna do a little eyebrow lift on Sarah as well. Just very, very subtle. It's not a cat eye. If you want a cat eye, though, you can consider video ads. I can do that. Not everybody. Okay. So if you want to stay for this, Ashley's pulling something up for me.
Book your talks in the next 24 hours and get 15% off.
So if you book your next tox appointment, okay, yeah, that makes sense. Book your tox appointment in the next 24 hours, starting now. Get 15% off your entire tox treatment. So call to action. I would take advantage of it.
You are a VIP in the next 24 hours. Get 15% off. Plus a free gift.
VIP members who are watching, you get 15% off, and you also get a free gift.
Book in the next 24
hours. You got this. So, okay.
Yeah, injector. I think we've still got watches.
Okay.
We've still got 3
So
watchers.
yeah, I appreciate you guys watching me. There's a lot more to it. I didn't realize that I could talk for 30 minutes straight and get all my information.
She was so nervous, but she's actually great at it.
It's like public speaking.
No, but it's really not public. It's pretty.
When you say it like that. I'll be doing my next video the third Wednesday next month.
You've got a comment.
Oh. Yes, Deb, they help with headaches. They sure do.
Yes.
Neurotoxin, I mean, depending on where you're stressed, they absolutely can help your headaches. Yes.
Most definitely.
They sure can. And then, oh, did you respond to that? Somebody did.
Betsy must have.
Oh, she watching me?
She's buzzing. Supporting the crew.
Yeah.
Yeah.
I love it. So, yeah, my next webinar will be on filler. So please stay tuned for that. That's my jam. So please, you're welcome, Deb.
Poker.
Yeah, let's poke. If you guys want to watch me poker, let's do it.
Ask more questions. I'll be here manning the chat.
Yes, she's one of those.
We'll show.
We'll show. Yes. Because Sarah's tough. So typically, if any injectors are watching and they're like, "Well, you're really low on the forehead," you should also know. Everybody's
This thing
different.
vibrates. You don't have to,
Yeah.
but that's what you would do to distract.
It just gives you, distracts the nerves, and it gives you something else to focus on. So it's a little bit. I have to use it. I actually do it myself for music.
Yeah.
Ashley knows.
Megan's a chicken.
I'm a chicken.
It's okay.
Perfect. Chicken. So we're gonna start injecting here, and Sarah is amazing.
Move you guys closer so you can see.
And if we get a bruise, I'm gonna let you know. That happens. We sure look for that vascular. I turn these half inchers around all the time.
Nice. Nice touch.
Nice touch.
Thanks.
Nice touch.
How's the pain, Sarah?
Oh, it's fine.
What would you say out of 10?
1. It's nothing. It really.
Little pinches.
It's less than getting your blood on. Nothing.
And there's a great result from this. Sorry, I'm business here.
I don't know. Some people are more sensitive to their face than others.
That one,
You see a little flinch.
that one did make me flinch. I felt it.
I'm going a little slow because I'm looking for a vascular. Because our goal is not to bruise our patient. Maybe you can see the little blebs that come up. Oh, delayed. That's the little mosquito bites that I'm talking about. Perfectly normal. They will go away shortly. And Sarah, what look are you going for? You want to like have your wrinkles gone?
I'd like to have less of them.
Less of them. That's always a goal. Forehead is
Great.
done. Easy peasy. Okay, so we're gonna go move to the 11s. That's where I have you animate. Yep, so right there with that little bulges. Relax for me. Perfect. And then, so this is not the frontalis right here, just so everybody knows. This is what brings in those limits. So if you inject too low on the frontalis, drop. We don't do that. Nor have we ever. Just go ahead and make a face for me. So if you can see that big old bulky muscle there.
Oops, shadow.
No,
Sorry.
you're good. Big old bulk and relax. Trouble eater.
Megan's holding pressure so that she can avoid
Very
a
light pressure.
hematoma, but
Yes.
mostly it's really hard to get a bruise, but
Very hard. You'll bleed a little bit.
you can bleed, but
No
for it to
bruise.
show up on the surface of the skin is very difficult.
Yes. You hold pressure. And I just hold underneath that muscle. Crazy pressure on her. You can go into that muscle, but it's a sphincter muscle. That's the whole muscle that's on your eye. So if it gets into that it comes, but it has a bit to travel through there. So you come before me and relax. Right in. And I dose Sarah properly for her. So how much she works out, how her metabolism is, all of them. So that's what we kind of talk about whenever you come in for a consultation and also your appointment. That way we can give you the right dose. Ready for me? Relax. Do it one more time. Okay, relax. So Sarah came in, she's like, I work out 6 days a week. I do this, then we definitely change it. Okay, one more time. And one more time. Okay, relax. All right. It's a very superficial injection, so you have a little bit more nerve endings there. Okay. So this is where it gets very vascular, very higher risk of bruising. So if you make a really big cheeky smile for me, if you can see her muscles here, all the way around. So you don't want to go too low. You low on a this muscle. You have your smile muscle right here. When you smile, you're gonna be like,
Shelfie.
shelf. You look like you have a shelf. So that's why we kind of stop injecting a little bit above that. So when you smile, you just don't create the lines in your smile. It's completely normal. So, all right, so she has a nice little juicer vein right there. We're gonna try to avoid it. No guarantees.
We're here, so
That's fine. We missed it.
love it. We love a good miss.
It's a success
swing and a
story.
miss.
Swing and a miss.
Probably shouldn't say that.
It's fine. Just go right into that tail, and this is that injection that's just gonna give her a nice little eyebrow lift.
Beautiful.
It's beautiful.
Beautiful. Beautiful.
Okay, TNAOs. These, even the best injector, we've never done it, but even the best injectors in the entire
Knock on
world,
wood, baby.
knock on wood, you have a DLI muscle right here that keeps your smile up, your bottom lip up. So it's right next door. Best injectors in the entire world have done that.
Mm-hmm.
We can fix it. So if it happens to you and you're like, oh my gosh, my smile is like, just come in. Don't fret, come in.
If it's before 2 weeks,
yes,
don't
if it's
panic.
before 2 weeks.
Don't
Yes.
panic yet.
Don't go further than that because it's going to be a lot harder. So your DAOs are what brings your smile up and kind of brings that lower face up. So go ahead and do your, and I feel that muscle nice and strong right there, and relax. Just go right in. Typically you can see exactly where it's at too without even having to move, because when you frown a lot, which Sarah doesn't, she's always smiling. Oh,
I'm just old.
oh
my God.
Oh, shoot.
Whatever.
She's fun. She's funny. All right, yep. Down and relax. Do it. I know it's hard. It's hard. Relax. Animation, when it's on demand, is actually a lot more difficult than you think. People, yeah. I'll be like, "Make your face." That wasn't it. Good job. Nice job. So I'm just gonna clean this area. And again, infection rate for Botox extremely low. More than likely not won't happen. So kind of like that DAO again for me. And relax. And then clench. So there's a little window. You don't want to hit the master, obviously. So do your DAO again, sorry. And relax. And that little jowling area again is gonna help you lift.
Mm-hmm.
And I've done it on my Ashley's done it on me, and I absolutely loved it. It was like my favorite. And I want her to do it again before she leaves me on maternity leave. Okay, go ahead and do your platysmal bends. So yep, hers is deep. So keep doing that for me. This one I just don't have you relax because I need to get that band here. Perfect.
Heck yeah.
I felt all the others, but not that one.
Not all of them.
Oh yeah, sorry. I'm just gonna sit it right here.
So make your frown. Yep, right there, that good old muscle, and relax. All right. There's different ways to do this. I think you do it a little bit differently than I do. but
Probably.
it all
That's
does.
fine.
It's fine. I mean, it all does
We
the
all have
same
our
thing.
techniques that we
Yeah. Click for me, sir. Grief.
That's stress right there. baby.
Yeah, we'll do it. It's the one. In front of me again. Yeah. Overall, what did you think, pain wise?
Oh, it was nothing.
Absolutely
Easy peasy.
Easy peasy.
Mm-hmm.
Right. Everybody who stuck
Appreciate you.
around, don't forget your call to action there, your discounts if you schedule in the next 24 hours.
24 hours. Yep.
Discounts always pretty good.
Get your discount and VIPs discount and a gift. Remember, thank you so much for watching. I appreciate it and your time. Sorry, I'm 17 minutes over.
And we'll kiss.
Mwah.
Bye, everybody.